Bismillahirrahmanirrahim. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And hello everyone. My name is Hijaz. Just call me Hijaz, all right? I'm a medical registrar in Black Rock Clinic. Part of my job is also to do an MD research program in epilepsy and neurology. I was where you are right now, I'm going to share some tips. This is simply my experience on how to tackle your day as an intern. It's busy, but it's something that's doable. So my way of doing this topic is by practical examples of how I approach my day. So first of all, congratulations, because it's not easy to get a job in Ireland, especially since 5 years ago that they have put a restriction onto EU graduates, even though you study in Ireland, onto non-EU graduates, especially even though you studied in Ireland, you understand your system, but that doesn't mean that doesn't qualify you for a space. But you managed to get one, which means there is an excellent quality in you that qualifies you to be in Ireland, and tell you what, you are going to make an excellent intern. The reason why this is a separate session is because the UK system is different than the Irish internship system. So the UK they call themselves foundation year, and they go through 2 years of foundation year training, whereas in Ireland you go for 1 year of training if you don't have any extension, with 3 months rotation each. So you have 4 compulsory rotation, and you need to do 1 medicine and 1 surgery as compulsory rotation, and you can choose others. But it's really hard to choose your rotation as a non-EU graduate. So the mindset of internship is about producing a safe doctor. And when I say safe doctor, it's not about that you need to know everything, because you will not know everything in medicine by the nature of the specialty itself, but rather it means that you know how to react or act in different circumstances or different clinical scenarios, etc. So it's about developing decision-making skills and knowledge, and but more importantly, it's about developing your character as a doctor. So enjoy the journey, because this is about making you a wholesome doctor in the future, right? So your character as an intern probably will tell you your character as a consultant in the future, whichever specialty you're taking in the future. So stop me anytime you want if you need to ask questions, all right? So reality check. This is a cartoon being drawn by one of an Irish. I think he's a registrar in anesthetics. I think Owen Kelleher. So this sums up pretty much what your day, what a doctor looks like. But you don't have to look this way at all. And I'll tell you why, because there are ways that you can make your day much more efficient without sweating yourself too much. All right. So setting your foot in the hospital. So when I was an intern, I didn't have we don't have a proper induction program from anyone really. So in my time, I had to do that. I had to learn on my own. Because of if I were to turn back the clock to become an intern again, the first thing I would do is to familiarize myself with the team, department, and ward in the hospital. Nothing is better than having yourself familiar with, not with the patients, but how the hospital runs, because each hospital has their own culture, each hospital has their own set of rules, each hospital has their own IT login, etc. So you need to familiarize yourself with how the hospital runs on a daily basis. Understand your role and schedule. That's very important. You need to know when you're on call, when you're not. You need to know what your role is as an intern and what you should and should not do. What's your limit? You need to know those. All right. So ask around, make sure that you know that from the first week, from the get-go. No two phone numbers. I think no phone number is more important than these two. So your reception and your cardiac arrest. So your cardiac arrest is, of course, the name speaks itself, but to know your reception number is the key, because it's just a phone call away about, oh, which number should I call for the ward, which number can you connect me to the other hospital, can you connect me to this. It's so important, and you can't. It's so important to know your reception number. Get to know that from day one. If you don't know, ask around your SHOs, your registrars, and the other person that's very good that you should know of is your clinical nurse manager. They're the directors of the wards, basically. So to identify them, usually they have two CNMs, or two clinical nurse managers for each ward. So know them, because they are going to be a friend throughout your stay in that hospital. Make enemies and you won't have a nice day, all right? So know the do's and the don'ts, the way that, for example, there are some consultants who want some things to be done in their own way, and you need to know that you gain by experience. Know the hospital policy, pathways, protocol, guidelines, etc. Ask for the app. So usually, for example, Arifin, where are you working now?
I'm working in Letterkenny University Hospital.
I see. So in Letterkenny University Hospital, you have your I think there's an app for antimicrobials that is kind of synced between Letterkenny, Galway, Mayo General Hospital. So ask for that, because they have this app that tells you how to run your, for example, how to manage your septic patients, which antibiotics to use, etc. So know that, ask them about the app in your phone. All right. I can send some other apps that's available for other hospitals. They're pretty good, actually. They're almost similar, but may have some bit of differences. And so just to know that. So this is how I run my day. If I were to go back to be an intern, and when I was an intern, I did this as well. So make sure I come early. And so the good culture is that you should be there before your senior members arrive. And the reason being is not for you to know what the patient's progress is, but it's to print the list, make sure you know the bloods, make sure you know the radiology from the day before. And make sure all the charts are there, you know, their primary diagnosis or issues, lab results, like I said, and then the carry on plan from the day before. So say, for example, you have a chest or anything that happens overnight. For example, if the patient spikes temperature last night, you should know about that. Or for example, if there is a CT abdo-pelvis that was done late in the evening, maybe around 8 p.m. You should have that checked the next morning. If not, if you know, like a non-urgent chest X-ray, you should have that checked the next morning before the ward round starts. So make sure that you know that the first thing I would do every day is I go early and print the list first. That tells me how many patients I have for that day, and that tells me how I'm going to run the day exactly. So, and then I make sure that all the charts are there, so that when the ward round starts, you don't run around like a headless chicken to find your charts. The charts are already there in the trolley for you to push around to start the round. Okay, so and so on and so forth. So that's how I would start my day. The definition of coming early is to come before your senior members come. And usually your senior members that you have to make sure that you have to come earlier than them are your registrars, at least. That's so your seniors help, your SHOs are technically almost the same level as you, but look for your registrar. Make sure you come earlier than your registrars, all right? And so ward rounds. I think the most important thing about ward rounds is that you that you are very organized. You organize the ward round so that it's as smooth as it goes. So nothing. So one of the things that kicks off a consultant in the morning usually is a ward round that is all over the place. So in order to cut that off, I think the most important thing is to be organized. And being organized, more important than not making a consultant pissed off, is to make sure that everything is there during the ward round. So the first thing I would make sure is all the charts are there. So your role as an intern is, for the first few weeks, maybe you don't have to write notes, but you will have to write notes as you go on, reporting investigations, reading the use chart, fluid, drain charts, and carry out the plan. So first thing when you get, when I carry out my ward round, I would have opened the chart before I arrive to their bed. And how do I know which patient is to go next? That's based on the list. So for example, I'm on bed 16 and I'm about to go to bed 20, which is 4 beds away. So on my journey there, I would have closed my the last chart and bring out a new chart before I arrive to bed 20. And that's sometimes it's hard, but it's doable as you go along. All right. So, and then the first thing I do when I arrive onto the patient's bed is I would take the bedside charts. So straight away, before anyone grabs it, I would grab it first, unless someone has a quicker hand than yourself. So during that ward round, I dislike things that are not discussed during a ward round. So for example, there is a vague plan that you don't understand why this. For example, your consultant wants a neurology opinion, and then you don't understand why do you need a neurology opinion. You need to clarify that there and there at that by the patient's bed before you go to the next, before you see another patient. And that's because you want to make sure that you carry out the plan as smoothly as you can. Sometimes what the nurses would do is that they would kind of pinch you, not talk to you behind the consultant, and just ask you, some bits that they themselves could have asked the consultant, but they don't. So that is something I don't like. But you need to, when they ask you, you ask the consultant straight away in front at that bed, at the patient's bed. Ask about that the concern that the nurses brought up to you, so that it's addressed there and there. It's not addressed later on, because next thing you do after finishing a ward round is to carry out the plan, and you don't have time to look back on things. So make sure that you do that, okay? And if they miss something, for example, a lot of patients came in with a UTI, and then overnight, and then somebody did a troponin on admission, and it was slightly raised, but nobody highlighted that. You need to highlight that. Clearly they missed something here. They might have missed a blood result, which might be or might not be crucial, but raise it up. Bring up the concern. Talk to the team about this before you leave the patient, so that somebody can have a look at it and act on it. All right. So that ward rounds are the most hectic part of the day, because you want to make sure it runs smoothly, and that's where you set that's how you plan it tells you how your day will go, and you want your day to go as smooth as you can by knowing all the planning that you are going to carry out. So I would suggest that invest your attention onto ward rounds. Okay. You guys can stop me if you want. All right. Ask away if you need to. It's a two-way session. So carrying out. So moving on to the second part of the day. So usually your ward round finishes at most around 1 p.m. Some days it may take up to 3 p.m. But by the time your next half of your day would be about carrying out the plan that has been discussed during the ward round. So what I think all of you are doing this right now. Use the same list that you print before the ward round starts to list the plan, and then prioritize your sickest patients. I think this is very important to highlight because your sickest patient is your priority that day. It will take your sickest patient will take most of your time, will take most of your energy, and most importantly is that the one thing that you want to prevent about your sickest patient is you don't want them to deteriorate. So that's very important for you to recognize. So during the ward round, what I would do is that I would identify the sick patients, and then I'll make notes on my list saying this is a sick patient, this is a sick patient. I should attend to them first, regardless of anything, how busy the day is going to be. My priority are the sickest patients, and I need to attend to them first, basically. And then and then after you sorted your sickest patients, then you go by your task, by what's more important and urgent. So there's this quadrant down here. Actually, this is from the book from Seven Habits of Highly Effective People by Stephen Covey, but you know what I mean. So you ask yourself what's most urgent and most important, and you can plan your day based on that as well. All right. So to me, what takes the longest and most important is radiology, because it takes time for you to go down to the consultant to discuss the case, and then it takes time. Maybe you discuss around 9 a.m., but it won't be done until 4 p.m. So if let's say you don't discuss at 9 a.m., you discuss at 12 p.m., it might not be done that day. So I think, to me, every day as an intern, radiology takes priority, especially for the sick patients. All right, radiology takes priority. You go down and make sure that that's done during that, so that it gets done during the day. And by the end of the day, you would be able to review the report of the radiology. So I would suggest you to think about radiology, to put radiology as one of the most urgent and important thing to do. This is just a small kind of way of me doing a list. This is just me writing on a paper, but you have much more printed. You have better printed lists. So, but this is how I do. So every time I done something, I would tick them. All right. Or something that needs follow up. Maybe I'll just color the half of the box and then leave the other half. And then once I've seen for example, the CSF results, I'll shade the whole box altogether, which means I've done enough act on it. All right. So this is how I run how I write my list. So delegate tasks between colleagues. So it doesn't mean if you're an intern, you can't tell your SHO to do something. Okay. That's important, because your SHOs are also your colleagues, and you need to tell them. You need to identify which are the things that are within your role and which is off limits. So, for example, if doing some things are procedure based task, and for example, if you need to do a pleural tap, so you're not probably you haven't done of course you haven't done a pleural tap before. You need to delegate that task to the registrar or an SHO who has done them multiple times, because you're not safe to do that procedure. So make sure that you tell that to the registrar or the SHO or someone who is equipped enough to do the skill, right? You tell them, because sometimes they expect you to do things which is not fair. You need to tell, and if they don't listen to you, you need to bring that up to a consultant, okay? The other thing is delivering bad news. It's not let me highlight to you that it's not the intern's job to deliver bad news, because that's not required as part of your role, as part of your skills yet as an intern. That's usually a registrar's job or a consultant's job to do that. So the whole point, to summarize the whole point of this is that I want to tell you that you need to identify that's how important it is to identify your role and what you need and what you shouldn't be doing. And the things that you shouldn't be doing should be delegated to the person who are well equipped or are qualified enough to do that job. All right. So that's very important, and you have to be strict about this, because and you have every right to tell your SHO or your registrar that this is not within my job scope. I'm not comfortable doing this. I think you should be I think you should be doing this. You have every right to say that. Okay. So that's very important. All right. You don't get bullied to do these things. I just want to highlight that there are some times you will, but you have to say no sternly, to these things, okay? Because this is not within your job scope. All right, and so the next thing after you carry out the plan is to follow up those plan, okay? So each of the tasks you perform, you have to you are held accountable to that task. So for example, you take a blood in the morning, and that doesn't mean your job is off. I'm done with my job. My only job is to take the bloods, nothing else. No, it's not. You have to review the bloods and act on it. Any scans that you book, you have to review it again and act on it. So that's very, very important. One of the things that my consultant told me when I was an intern, I did one mistake before, and he told me this in a very strict manner, but nice enough for me to remember until now. He said, "You don't make promises you can't keep." What it means is that everything you do, every single thing that you do to a patient is a promise. It's essentially something that you are held accountable for. So blood that you took from a patient, that's your responsibility for you to act on it, to have a look and act on it. All right. So keep that in mind, because it will be that way until you die, until you retire as a physician. Your patients, regardless of who you are, whether you're a consultant, a reg, an SHO, or an intern, you are held accountable for the patients based on what you do on them. Okay, so usually in a day, what the teams usually do is that they sit down in front of a computer after lunch to review the list and see what has been done or what hasn't been done. So I would suggest that what you would do is that you make sure that the team meets in front of a computer. You can see the bloods, you can see the radiology in front of you. Easy enough. That cuts off your job more than like 20%, because because a lot of things have been reviewed by the registrar or the SHO or senior team member. That's done. All right. So you don't have to, you need to find another computer to look at this again. You need to rediscuss again. No, everything is discussed on the second in the team meeting after lunch when they review the list. Okay. So highlighting abnormalities. So one good tip that I hold till now is do not end your day with any loose ends. All right. Whatever I make, especially as a registrar, I feel that I'm more responsible. I feel that I carry more responsibility for my patients, and I'm not really. I've been training myself to not leave the hospital until I know what exactly is going on with my patient, and that I've reviewed everything for the patient. And one good question that I always ask myself before I leave the hospital: are the patients well enough for me to go home now? Are the patients stable enough to survive the next day? Especially for the sickies or for the sick patients, I always ask that: are these patients safe enough to be left now? So keep that in mind, because you don't want to come to the hospital the next day knowing that, you've missed a hyperkalemia, you've missed a high CRP, you've missed this, you've missed that. It doesn't feel nice that way, because it tells you, because like I said, internship is about you building up your character as a doctor, and I think that's important. I think that's very, very important. All right. So on call, I think it's very important that you do your BLS and ACLS sorted now. Okay. And remember that on call intern deals with acute issues. So anything that can wait will wait. For example, a nurse asking you to do a family call, that's not your job. All right. Tell them nicely, but understandable enough that you are not going to call a family on a Saturday 8 p.m. just to sort a family member who's asking for an update, because number one, you don't know about the patient. Number two, this can wait till until Monday for the primary team to call the family member, all right? And also anything during on-call, if there's any sick patients, you need to let the registrar know, all right? Or an SHO know, because there's less staff working during on-call, and you need to know that there won't be enough hands to help you around. So don't hide or it will bite, okay? Any sick patients, you need to highlight it to the registrar or the SHO, okay? Don't sort it out on your own, even though you're comfortable with it. Keep everybody in the loop. So this is one thing that I think if I were to turn back the clock, I would have someone tell me, how do I discuss it to a case with a radiologist so that it's plausible enough for them to do a scan? So I think the important thing is to keep it short and simple. Nothing is better. And like I said, just now, the most important part of your day is your ward round. And when a consultant asks you for a radiology, you need to know what the indication is. You can't just ask for a CT of the pelvis without telling you why you need a CT of the pelvis. You're not expected to understand, to have the same brain wavelength as your consultant. So you need to ask them, what is the indication, so that you can discuss with the radiologist. So for example, I've given a kind of a short sentence, a short paragraph there of how I would usually say my radiology request, and it won't take long. If you know the indication clear enough, and you know the patient really well, it takes you less than 10 seconds to get a scan done. All right. They don't like long presentation and vague indication. Okay, they hate these two things a lot. So trust me, if you can avoid these two things while discussing with the radiologist, you would survive the day with the radiologist. All right. Okay. Look. One of the things that I want to talk about is character building. I think it's very important for us to think about it from now on, and what kind of doctor you want to be. So be kind. That's just, it goes without saying. You're kind to people, people will be kind to you. Making good relationship with others goes a long way. It's just invaluable, really. Being proactive is a sign that you are a good sign that you are interested, and you're very good as a doctor. So for example, when I was in urology, I always asked if I can get a chance to be in theater, just to learn how to suture, etc. My SPR, my specialist registrar, brought me up a couple of times, helped me suture, taught me how to suture. In fact, my consultant brought me up for an acute bowel obstruction once and assisted him for the surgery. So and then he gave me a few audits to be done, which is really great. So show that you're interested, regardless if you like the specialty or not. It tells you how much the character that you have. It's not about doing the task as well. It's about doing it right. So it's not about quantity. It's also about quality. You need to be a doctor who's meticulous with your patient. It's not just about, oh, I've done this, done that. No, it's also about doing it right. Okay, ask for feedback, say no in a kind way. And also remember that being an intern, being a doctor, you work in teams, all right? Nothing is more valuable than teamwork. Always keep your team members in the loop, okay? And trust me, this is Ireland, and people are helpful. They appreciate you talking to them. They appreciate you discussing with them, all right? They will help you out no matter what, and you have people to go to, okay? And so be the first to arrive and last to leave, unless the team tells you to go home or take a day off. So take a day off if the team asks you to, okay? It's healthy, and it's a sign that they appreciate. It's a recognition that they appreciate your hard work for the team. So we're almost. If you have any questions, just ask me. But just a few housekeeping. Revenue.ie. Make sure you sort this out with your HR. You don't want to be on emergency tax. It's killing. You won't be able to pay your rent if you're on emergency tax. Have your intern feedback form signed 2 weeks before you're completing your rotation. Think about your specialty by October, because the BSc, or the Basic Specialist Training Scheme, interview application is around November to December, but the interview is around January, February, and you can apply to multiple specialties, right? But you have to think about what you want to apply. It costs about 100 euros, I think, per application. I can remember, but you need to think about it. Fill in your timesheets correctly. Okay, make sure you're being paid on time and correctly as well. Never miss intern teaching sessions, and plan your holiday in advance. Okay, I know you. Well, actually, to be honest with you, I only go back to Malaysia when I was an intern because that's what you miss most. But plan your holiday, okay? It's healthy for you, and it makes it easy for you to work as well, and easy, for your team to know if you're not there. Okay. So look, any questions or concerns, or do you want to? I'll actually leave you I'll actually leave you my phone number later on or something if you want. Just in case if you need to talk or anything like that. All right. Okay. Everyone's okay? Oh, yeah. Okay. Yeah. So look, and some hospitals, this is kind of a bit of a motivation. Some hospitals, they have prizes for interns. So alhamdulillah, thankfully, I won the Surgical Intern of the Year award. So keep an eye on that. Okay, it's not that you do your job. You should do your job sincerely, but it's just a motivation that can push you a bit if you to win this. And it's a good it's good for your CV when they look at it in the future, right? And it shows character basically. All right, best of luck, everyone. Hope you will enjoy your intern year. It's fun. It's great. You make a lot of friends, and I if I were to turn back time, I would be an intern again. But sadly, I don't have time to do that. But yeah, enjoy your time as an intern.
Hello.
Hello.
Hi, Hijaz. Sorry, I've got a couple questions if that's okay.
Yeah, go ahead. Yeah.
I'm just asking, like, when you mentioned about coming to work early as well, would you, so say if the team is scheduled from like 9 to 5 every day, but you come in at 8, would you cross out the extra hour in the morning?
So as long as, so I would come at around 8:30 if that's the case, and I would, because you have started your job earlier, that's technically halal for you because you are starting your job. It's not that you come and then chill out or something. You come because you had to do your job. You had to print out the list, look for the bloods, etc. So that's your job starting from that 8 o'clock. So technically, you are supposed to be paid for that, and you should put that up on. But I would suggest that you don't make it too early because they would be suspicious for you. Make it as near to the working hours. So, for example, come at 8:30 instead of 8, because it's not long to do it doesn't take too much time to do that anyway.
Excellent.
So I would make it like 8:30, and then you should put that up on your timesheet.
Sure. Thanks so much.
Yeah. Okay, I think we'll just I'll catch you up later on if there's anything. Okay, and I'll see you later. Okay, we'll leave the breakout room now.